Gentlelady yields back. Now recognize the gentleman from Texas, Mr. Crenshaw, for his 5 minutes of questioning.
Thank you. Thank you all for being here. Start with Mr. O'Brien. You know, in a state like Texas with a large share of nursing homes and assisted living facilities located in rural areas, how does portable ultrasound help ensure seniors receive that timely diagnostic care without being transported long distances?
I mean, I don't know much about your bill, I'm sorry, Congressman, but I again, believe in care in the home. I think it's, patient-preferred, cost-effective. So having the ability to have portable, imaging in the home would be something that's very, very important.
Okay. Thought you would have more of an answer for that. Would you think that being able to bring it to the patient would bring costs down?
I'm sorry, can you repeat that, sir?
Bringing this kind of technology to the patient, would that overall bring costs down?
Newer technology that could be done in a home care setting, I think at the end of the day should certainly be able to bring costs down, not being a subject matter on this particular product.
No problem. Ms. Van Meter, what differences did you see in how current payment policies affect hospital-based laboratories, physician office laboratories, and independent laboratories? Why does that matter for patients?
Well, the current Medicare payment system, the clinical laboratory fee schedule, has suffered from years of deep reductions. It's the only Medicare payment system that is designed to be based on commercial market rates, but has failed to do so because it has collected lackluster data. Only 1% of laboratory data was used to set rates, and we're still living under data that's from 2016. So that it has a compromising effect in terms of long-range innovation or investment in innovation. We appreciate that Congress has stepped in and has halted reductions. We believe that the Results Act that has been discussed today is the right approach to allowing there to be stability in that payment system to ensure patient access, to have swift turnaround times, innovation and testing, broad patient access.
Okay, thank you. And Ms. Sullivan, from the patient's perspective, how does the availability of home infusion services influence where seniors ultimately receive care, particularly when managing complex and chronic conditions?
Thank you, Congressman. The range of medications that are available to patients in the home, if you have commercial insurance, reaches above 300 different individual medications. Unfortunately, for Medicare beneficiaries, they're limited to a handful of drugs that are that use an item of DME or an infusion pump to be administered. So they live with much more restricted access under the Medicare program. If they were to have access at least to IV antibiotics, we estimate it would change the lives of many beneficiaries and just open the options up for them to receive care at home rather than driving back and forth to facilities or being admitted to long-term care facilities.
Can you comment on how that might affect long-term costs, savings? Do you think it remains neutral? Do you think it saves costs?
Yes, excellent question. Historically, the Congressional Budget Office has scored home infusion legislation as something that would generate savings. We're still waiting for an updated score on the provisions in this bill. However, when we look at care in settings such as hospital admission or at outpatient departments or urgent cares, generally we feel confident that that home would be a more efficient model for those patients.
Okay, thank you for those answers. I yield back.
Gentleman yields back. Now recognize the gentlelady from Indiana, Ms. Houchin, for her 5 minutes question.
Thank you, Mr. Chairman. Thank you to our witness.